Suspected and confirmed cases of monkeypox in the US, Canada and Europe are becoming a cause for concern. The disease is usually found in Central and West Africa and is spread through close contact. Cases identified outside of Africa have been linked to international travel, but scientists say that it's unlikely to spread in the same manner as the coronavirus.
Though largely occurring in West and Central Africa, cases of monkeypox have been reported in the United States, Spain, Portugal and Britain. The spread of the illness outside of Africa is rare and has caused concern. Monkeypox is a mild viral disease whose symptoms include fever and a distinct bumpy rash. It was first identified in monkeys and is most typically spread through close contact. The first confirmed case in Europe was identified on May 7th in an individual who had returned to England from Nigeria. Though similar in its means of transmission, officials do not believe monkeypox will spread at the same rate as the coronavirus. Scientists say immunization against smallpox is an effective way to prevent the disease, but smallpox immunization programs in Africa were stopped after the eradication of the disease. Officials say this could explain the increase in cases on the continent. The UK Health Security Agency says it will offer the smallpox vaccine to health workers and those at high risk of exposure.
For the latest, we're now joined by Professor Jimmy Whitworth, who's a Professor of International Public Health at the London School of Hygiene and Tropical Medicine. Prof, thanks very much indeed for joining us. How rare is monkeypox in Europe and other parts of the world beyond Africa?
Good evening. It's rare. I mean, in the UK before the last couple of months, there'd only been, I think, 7 cases ever reported in the country, and there are only a few other countries where it's occurred outside Africa. I think Israel, Singapore, the USA have had cases before. So this is a very unusual situation.
Is it a cause for alarm? I mean, does it spread easily?
It's a cause for concern. I would say it's not a cause for alarm at the moment, but it's important that we learn more about it. From what we know of this when it's been passed on by travellers before, or from what we know about it in West and Central Africa, it's not highly transmissible. This is a disease that's normally found in rodents in forested areas, and people come into contact with it when they're in contact with those rodents, and it may spread to 1 or 2 people, but you don't usually get sustained transmission like we're seeing here.
I believe that there are 2 strains, one more dangerous than the other, Congo strain and the West Africa strain. Which strains are we seeing manifesting in Europe and North America?
From what I've seen, all of them have been West African strains that we've seen there, and that's some relief, as that one is less serious than the Congo Basin one. So, for example, with the West African one, the case fatality rate is about 1 in 100.
All right, and the other one, the Congo one, what's the fatality rate on that?
That's about 1 in 10, so wow. 10%, so wow. Considerably more serious.
So can people travel and be asymptomatic and that symptoms manifest later? Is this how they're able to move from one country to another?
Yeah, I think that's right. The incubation period, in other words, the time from when you become infected to when you actually manifest any clinical signs, is about 2 weeks. Can be anything from 1 to 3, but on average about 2 weeks. So that means you could get infected in a Nigerian village, say, get a flight to London, and then become sick once you're in the UK.
Talking about the UK, it sounds as if the cases that have been found are not connected. That makes it even more curious, doesn't it?
It does indeed. normally you do see that connection, and it is worrying if we can't connect the cases that are happening, because that means that there is probably community spread going on, and that there are cases that have not been identified yet that allow us to understand how the chains of transmission are occurring.
So what should people be looking out for in terms of symptoms, early symptoms, and what they need to do if they suspect something is not quite right?
Yeah, very good question. So the early signs are fairly general and non-specific. They're things like headache and fever, but you also feel tired and you feel pretty miserable, and that's sort of you feel pretty sick, and you won't want to be moving about much. You get swollen lymph nodes, but then later you get a rash, and it's a sort of characteristic rash with pustules, and then those will form into scabs. It can be itchy, so that's really the hallmark of the disease, and that people would recognize. So if you have symptoms with a rash and you've been feeling pretty ill before that, or you've been in contact with somebody who's been diagnosed with monkeypox, it's important to contact your health worker or ring a helpline if those exist, and so on, to be advised what to do next.
If this virus is found mostly in sort of Central West Africa, can we expect it to travel to other African countries now that we've seen it go as far as Europe and North America?
I reckon it could travel anywhere by international travel, with somebody who's incubating the disease, and it spreads by close contact. So either touching somebody, or from bedding or shared utensils or things like that. That's how it tends to spread. So if somebody arrived anywhere in the world incubating it, then they could pass it on to somebody else.
Let's talk a little bit about treatment. Is there anything that can be done, or it's just a question of running its course?
Well, most people who have it will recover, and they'll recover fully within a couple of weeks. So that's the good news. There isn't any specific treatment, so it's supportive treatment, really. It's making sure people are hydrated and comfortable, and are getting food to eat, and so on. Those kind of things. That's important. There are one or two drugs which have been used experimentally, antiviral drugs, which show some promise, but nothing that's been licensed yet. So those are just being used in specialist hospitals at the moment. But the other interesting thing is that smallpox vaccine does give considerable protection against this. And so people who have been exposed or at high risk of exposure can be offered smallpox vaccine, and that can prevent infection and disease.
I'm still trying to get my head around the transmission and how it spreads from one person to the next. Close contact, are we talking a hug, a handshake? What are we talking here?
Yeah, hugs, handshakes, those are the kind of things. The rash, when you have the rash and you have these pustules and those scabs, that's where the active virus is. And if you're touching that, then that gets onto you. It can get into the body through small abrasions, cuts that you don't even notice. So that's the kind of way in which it will spread.
All right, so which countries are showing the most cases at this stage, beyond West Africa and Central Africa?
In West and Central Africa?
No, beyond Africa.
Oh, okay, beyond Africa. Well, most of the the confirmed cases have been in the UK. Spain has some confirmed cases, but also has a considerable number of suspect cases. Portugal has cases, and then there are individual cases that have been reported in Sweden and Italy and France just today. And there's a case in the USA that's in hospital, and some contacts and suspected cases in Canada as well. And all this has happened extremely quickly.
Are these travellers people that have come from somewhere, or is it locals that have probably come into contact with someone who has travelled?
It looks in most cases like they're people who have not travelled and have, as you say, caught it in the community. But there are some exceptions to that. The case in Italy, that's somebody who had recently travelled from the Canary Islands, and the USA case had recently been in Canada, but not travelled to Africa. And that's the puzzle. So it does look like there's transmission that's occurring in an unusual way outside of Africa.
It's happening quickly. Might we see more infections? And what do you do to contain it? I mean, it's not like coronavirus, but it looks like if it is community driven, it could be a problem.
Yeah, you're absolutely right. I don't think we have uncovered the full scale of the outbreak that we have at the moment. And so it's good old-fashioned foot slog epidemiology that's required at the moment. We need to identify the cases, make sure they're isolated and treated, identify their contacts so that they can be monitored and supported and treated if they need it. And of course, very importantly, we need to be engaging with the communities at risk to make sure they're aware of this disease that's spreading and know what they can do if they suspect that they've got this infection.
Professor Jimmy Whitworth, we're going to leave it there. Thank you very much indeed for joining us. Your insights greatly appreciated. Thank you.
My pleasure. Thank you.
Thank you.